Well, it's the issue that provokes a lot of debate. Vaccines, do they work? Is there a risk? And why do those who don't believe in them feel so passionately that they are either useless or worse, dangerous? The National Checkup panelists are all believers that vaccines are critical to fighting disease. Tonight, we make them try to defend that position. At the table, Dr. Danielle Martin, a family physician at Women's College Hospital in Toronto. Ubaka Ogbogu is an assistant professor in the Faculty of Pharmaceutical Sciences at the University of Alberta. Dr. Jacob Udell is a cardiologist at the Peter Munk Cardiac Centre, and Dr. Alison McGeer is the Director of Infection Control at Mount Sinai Hospital. Their thoughts in a moment, but first, these facts. Here are the basic facts for vaccines from the view of those who advocate their use. They prevent 6 million deaths worldwide each year. In the case of measles, 90% of those who are not vaccinated will catch the disease if they come in contact with it. If youngsters get the prescribed 2 shots at the right interval, almost 100% will not be infected. A community needs a widespread buy-in for vaccinations, about 95%, to achieve what's called a herd immunity, where measles outbreaks are highly unlikely. Well, all that's pretty impressive, but there are disbelievers for a lot of reasons, but especially this one. A 1998 study in the highly respected Lancet Medical magazine that linked the MMR measles vaccine to autism. It was done by a British gastroenterologist named Andrew Wakefield and quickly became very controversial. After 12 years of review, The Lancet reversed its endorsement, calling the Wakefield study utterly false. But vaccine deniers still point to his discredited study and encourage resistance. And that's where we are today. Governments...
Don't indulge your theories. Think of your children and listen to the experts.
Are you telling parents you should get your kids vaccinated?
You should get your kids vaccinated.
And medical practitioners desperately calling for vaccines as measles seem to be making a comeback. All this raises some basic questions, so let's get at it. And very basic. Let's start with the measles vaccine. What, Danielle, is actually in it?
So all vaccines are actually made of a very tiny amount of the actual agent that causes the disease or the illness, in this case, the virus that causes measles, which causes your immune system to mount a response and make antibodies so that if you ever encounter the actual disease, your immune system is ready to fight it.
What else is in there, though, other than that?
So there's a range of different preservatives that get used. Sometimes when we have vials that have more than one dose in it, there are stabilizing agents. Those are in really infinitesimally small amounts, which have all been found to be safe.
Okay, well, that is the issue, though, for some people. Some of those infinitesimal amounts, whether they're mercury or aluminum, Ubaka, why are those in there, as Danielle says, as preservatives? But tell me a little more.
Well, as Danielle said, they're added in very small quantities, almost negligible, to either preserve the vaccine to prevent contamination or to activate the immune system. Now, what's important to note is that some of these chemicals are actually removed from the product before they are packaged. And anyone who's worried about these vaccines and the chemicals in them can always speak to a healthcare provider to ask questions. The information about the chemicals is disclosed on the product label. There's more chemicals in a bottle of children's Advil than you'll find in most vaccines.
So when you get your vaccination shot, you should ask the doctor,
yes,
let me see that label. I want to see exactly what's in there.
Yes, you can always ask your healthcare provider and they'll give you that information. And that's actually very important because you may have an allergy to something in the vaccine and you'll want to know through the process of disclosure and discussion with your doctor what's contained in the vaccines.
You know, I heard one person say there's more mercury in a tuna sandwich than
right.
there would be in a vaccine.
Right.
Yes.
True?
Yeah.
Okay. Question came in. We've had a lot of questions from viewers that have come in through social media, also through Skype. Here's a quick one, Alison. You handle this one. Here's the question.
What are the risks associated to vaccines?
Okay, very general, but what are the risks, Alison? Are there risks associated with a vaccine?
Well, yeah, the most common one, because most of them are given with needles, is you get a sore arm afterwards, and that happens a lot. In children, not so much in adults, but especially in young children, they can get fevers, sometimes very high fevers and things that are called febrile seizures, which are not serious but can be very scary. Everything after that is much less common. The most common serious side effect with vaccines is having an allergic reaction. As has been pointed out, there's a number of different things in vaccines, so if you have allergies, you can get an allergic reaction to what's in the vaccine, and that's why it's important, if you have allergies, to have a discussion with your provider about what's in them.
All right, aside from allergies, Jay, are there people who should not have vaccines?
Right, so coming back to last time we were on, so if somebody is taking a live but an attenuated or in an activated form, then there are some restrictions. So some people who have a compromised immune system and some people who are pregnant, those are folks who shouldn't be getting the live version. But most vaccines that are not alive, that are either killed versions or just parts of the vaccine, they're not alive, they can't actually do harm. There's very, very few restrictions, but probably the biggest one would be a prior allergy or an allergic reaction to any of the components that are in the vaccine.
Do you think it's possible, Allison, that the kind of things we hear about people who say, look, you know, this isn't working, there are dangers to this, are really those who are either allergic to it or some of the things that Jay's mentioning, and then it kind of spins out of control?
Well, some of it is about people who are allergic, but the really hard part about taking a vaccine is that you're voluntarily, actively taking on a risk. You know, it feels a bit like, okay, so if there's a disease out there, I might be lucky and not get it. But when I get a vaccine, I'm very obviously deciding on a risk, and just the way our brains are wired, that's a much scarier thing to do. So that's what starts us being worried about the vaccine, the fact that we're hardwired to be really anxious about it. The second difficulty we have with vaccines is about things that happen after you get vaccinated, but aren't related. When something bad happens to you, or worse, your child, you want to understand the reason for it. And if you've any time in the past little while had a vaccine, then you tend to think the vaccine might have caused it. Okay, I mean, you also tied your shoes and had showers and did other things that aren't associated with the side effect either. But vaccines are relatively easy to blame because of this emotional fear reaction that you naturally get to them. So a lot of what we worry about is stuff that happens after vaccination, but isn't caused by vaccination. Still feels like it, though.
All right. Here's a question that came in on Facebook. Have a look at this. It's from Seller Rob in Corner Brook, Newfoundland. And the question is, if a kid is vaccinated for a disease like measles, how are they affected by a kid who does have the measles? Doesn't the vaccination make him immune to the disease? Rebecca.
So according to the Public Health Agency of Canada, and this is very well scientifically established, the vaccine, the measles vaccine, for example, provides almost 100% immunity to the disease. The chances of a kid who is vaccinated getting measles from a kid who isn't is almost non-existent. It is not likely to happen at all.
Danielle?
Right, but so what we do find, though, is where we worry about the population is if we get enough people who are not vaccinated or enough people who are choosing not to vaccinate their kids, that over time, you know, a single unvaccinated person bringing a case of measles, for example, into a school could lead to a really serious outbreak. There are other groups of people who are especially vulnerable. So if an unvaccinated child is infected with the measles and then comes into contact with someone whose immune system is suppressed, or with a pregnant person who wasn't immunized in childhood because she comes from a country where she didn't have the same routine immunization schedule, those things can be very, very serious. And so if your kid's been fully immunized and had 2 shots of the MMR, you don't need to worry that they're going to get measles if they're exposed. But there are lots of people who we do worry about in that situation.
You know, we heard in the pack this discussion about the herd immunity that's needed, that a certain a percentage of the population, more than 90%, I think it was, have to have been vaccinated, or you run the risk of a measles outbreak. So it's somewhat linked to that question. But do you want to talk about that, Jay?
Sure. So, I mean, it's a bit of you're buying into a societal expectation that if we as a group decide that we make some certain public health decisions that are in our best interest, that we're protecting everyone. It's like wearing seatbelts, frankly, in my opinion, in terms of us going out there. We're not seeing a lot of fatalities, motor vehicle fatalities, for the same reasons. So if that 95% threshold starts to go down, there are going to be these pockets of outbreaks. And then there are people who might think they are vaccinated. Then unfortunately, bad things happen. Some people can become, develop cancer, can be immunocompromised, become pregnant. I mean, I can't tell you how many times friends of mine who were pregnant, they get their checkups and they get told their titers are low. And it's not because they didn't get vaccinated, it just sometimes happens. And so there are people that potentially could be at risk. And as a group, we are essentially being held hostage at times by people who may decide, for whatever reasons, that they're not going to get vaccinated. The rest of us are essentially at risk. And so that's a big question.
Do you want to add to that, Alison?
Yeah, the trouble with measles is that the rates have to be so high. There are lots of other vaccines where you don't have to use as much of them to develop the protection. Measles is so infectious that it's one of those things where even a small percentage drop in the number of people who are getting vaccinated makes a difference. And that is why we have outbreaks of it. It's why it's so much harder to control, why it pushes us to these discussions about who should be vaccinated.
Well, who isn't getting vaccinated? Danielle?
Well, in my own practice, I see some people who are what we call vaccine hesitant, just people who want more information, who may have been reading on internet message boards, incorrect information and want to learn more. And most of the time I find that, we can find our way through to some common ground. But then there are other people who either for religious reasons or because they've bought into pseudoscientific explanations for why vaccinations are a bad idea, who, actually the opposition can feel almost religious in the sense that no amount of evidence, no amount of science, no amount of human history. I say to my patients, there are very few things in the history of humanity that have made as much of a difference to the health of the population as vaccination. First, we separated the sewage from the drinking water. Then we developed vaccines. Like if you were drawing a graph of human history and human health, those would be two of the big points on the graph to point out. And yet somehow, sometimes those conversations just go nowhere.
Should vaccines be made mandatory, Rebecca?
Absolutely. I believe they should be mandatory. Vaccines, mandatory policies have historically achieved the highest rates of our coverage. Other methods of encouraging or promoting vaccination, such as education, or providing incentives haven't worked quite as well in being able to bring the rate of coverage up to what we have described as herd immunity. I also think that in this kind of situation where parents are making decisions on behalf of their children, they should be making decisions that are in the best interest of their children. And the evidence is really unequivocal on this. It is in the best interest of those who are vulnerable to get them vaccinated. And if you don't do that as a parent, I think society has an interest in the matter, and society should impose vaccination on the child because that's what's in the best interest of the child.
Mandatory, Jay?
So you have to be careful with what you wish for, so you're going to have to deal with mandatory. And we were discussing earlier, I think that there is a benefit to that approach in that sense that then we are forcing upon people, at least at minimum, having a conversation. I mean, what are we going to do in terms of enforcing that mandatory policy? I think at the end of the day, there has to be limits on that. But I think forcing the conversation and taking people who are otherwise sitting on the sidelines and forcing them to have a conversation with their healthcare provider is important. And I think that healthcare providers can probably do a better job of discussing this with their patients. I think we have to give some validity to the point that there is potentially an allergic reaction or some very rare reactions that can occur and that are horrible when they do occur. But a vast majority of patients will benefit from these vaccines, as human history has shown.
All right, I got to take a quick break. But when we come back, we'll try this question. What accounts for what seems to be a growing mistrust of the medical system? Welcome back to our National Checkup on the debate around vaccines. In studio, doctors Danielle Martin, Jacob Udell, Alison McGeer, and lawyer Rebecca Ogbugu. The debate around vaccines is nothing new. Look at this cartoon from the 1930s, which will give you some indication of how far back we go. Anti-vaxxers, as they're now called, at the head of the line that ends with anti-everything, going off the cliff of misinformation right into the debate over the smallpox vaccine. So we still see, an element there that doesn't believe in this, but also it kind of suggests, I don't have any data on this, but it does kind of suggest, because of the publicity they get and social media and various other things, that there's a growing mistrust of the medical system. Why do you think that is, if in fact that is the case, Danielle?
Well, I think when it comes to vaccines, in part it's this desire on the part of the media, and we see, in the debates on the internet about these issues, that somehow there's people feel obligated to give balance and therefore to present sort of both sides of the story as if there were anywhere, remotely near to the kind of rigor or science on the anti-vaccination side of the so-called debate. And I think that we give false credence to those views when we hold them up as somehow offering a balance or a counterpoint to the mainstream perspective.
No balance on this panel tonight,
That's
as
true.
all four of you
That's
are
true.
defending this position. But Rebecca?
Well, I think it's important to begin by stressing that Canadians do have a high level of trust in healthcare professionals and the healthcare system. But we've seen some reports of people who feel that the impersonal nature and the often rushed nature of the services that they receive from the medical system is something that they're not happy with. So they seem to blame that, which might just be an indication of the strain on the system, the lack of the strain on healthcare resources. They blame that on the medical system, and they tend to take that out on their healthcare professionals. So that distrust might be associated with that. But for the most part, I think people do have a high level of trust in the healthcare system.
Jay?
Yeah, I think I have to agree, and I think both of your points are really valid. I think, again, the onus is somewhat on the healthcare providers to be better at making the message simple and getting that message out there, and also, taking on the challenge to, I think you're right, I don't want to validate anybody's misbeliefs, but to be right there on the front line to put those misbeliefs to rest and essentially reassure the public and those patients that are in your office asking questions.
Alison, you get the last word.
Well, one of the things we do want to do is have patients asking more questions. Partly we've encouraged this. It's not a question of mistrust, but it is a question of we want patients to be in charge of their health and in charge of their health care. So there's an element that says we want to welcome these questions. At the same time, we really need to recognize that the evidence in favor of vaccination is overwhelming, and we need to stop talking about it, as Danielle said, as if there are two sides to it, and really recognize that, the Earth is round, the sky is blue, vaccines work,
All right. Well, on that, we'll leave it for this table's discussion. I'm sure there's lots of discussions going on at homes across the country. You've been watching this. Thank you all.